Good evening, everyone. Welcome to today's broadcast on selling your immune products apart from the rest with Propolis. I am Angeline Ong, the marketing specialist of Nexus Wise, and I will be your moderator for today's event. Before we start, and to ensure an uninterrupted sharing, we would like to keep all our audience muted during these whole sessions. However, you are all welcome to interact with the speaker by typing your questions in the Q&A box located right below of your screens. If you are experiencing any technical problems with viewing or even hearing the event, please click on the raise hand widgets in the dock at the bottom of your presentation window. Besides, if you would like to connect us via the online platform, please do not hesitate to reach us at our official social media pages of Facebook, Instagram, LinkedIn with the QR attached above. Even before COVID-19, consumers were placing increased values on health, wellness, and disease prevention. Hectic, stressful, and sleepless modern lifestyle had become normalized. Then, the novel coronavirus pandemic upended life around the world, disrupting markets, altering priorities, and accelerating certain market trends. After many changes hastened by the pandemic, one that experts anticipate enduring it to consumer thinking more about how to maintain a healthy immune system. COVID-19 will have a lasting impact on all of us. Although it's possible that decades from now, immunizations and medical advancements will allow us to be less hypervigilant, certainly less terrified about our health. But in the near future, it's probably safe to say that our habits and awareness of healthy practice have changed. With more consumers now looking for foods with benefit than for passive health positioning, for example, organic, clean, or natural, the timing for tilting immune boosting components, whether naturally occurring or through fortifications, will have to happen right now. What do you think sort of future global markets for immune health supplements are going to look like? Since ancient times, man has been using the bounties of bees to heal and prosper. Bee products, especially honeys and propolis, have found widespread use for centuries in traditional medicines. The Egyptians used propolis to stop the decompositions of bodies during mummification processes, while the Greeks were the first to transform beekeeping into farming. Hippocrates prescribed propolis for various kinds of disorder, both internal and also external. Not forgetting Romans, who were very much fascinated by the world of bee. It was in fact Pliny the Elder in his natural histories who coined the name propolis after pro, which carried the meaning of before, and polis carries the meaning of town. Over 180 phytochemicals in propolis are known to have biological activities in mammals. Within these special forces, bee propolis is among the elite. Both the seasons and region in which propolis is collected will definitely influence its chemical compositions, resulting variations in the biological activities. Significant differences in compositions and also the concentrations of certain chemical compounds in propolis itself is going to make us standardizations and quality control challenging. In addition, the lack of uniformities in evaluations methodologies, as well as the analytical technique, make it extremely difficult to correlate data across the climatic zones. Yes, the product is difficult to manufacture. It's even harder to market, and nevertheless, it's definitely going to be a bloody nightmare to chemically characterize. We will still have to deal with that. Why? This is because industrial experts had come up with an analysis foreseeing propolis to have a huge future in the natural product industry. I know you're confused with the challenges I just mentioned above. Is it still worth the risk to venture into these directions? What if I'm suggesting a solution that may make a difference? Along with Be Natural's modern science to create a form of this ancient remedy that ensure you consistency, quality, and even ease of formulations, we are definitely seeing something big coming. At Nexus, we demand more than just being a healthy ingredient distributors. Our mission is to nourish billions of lives worldwide. Are we gonna do it by ourselves? Definitely no. We require a committed partner to put this to work. Inspired by the outstanding work of Bees and also leveraging a 30 years experience working with natural products, Be Natural is committed to extracting values and quality from nature, particularly from beehive. Both Be Naturals and Nexus have been acknowledged for their innovations and share a common interest in developing high quality products supported by strong clinical evidence. We are more than delighted to form these collaborations, and we would definitely want to bring you along to make a difference in this industry. Today, we are pleased to invite Dr. Alberto Cosi, the representative from Be Naturals, in sharing his thought for this topic. Dr. Alberto is a dedicated professional with an experience of more than 10 years in pharmaceuticals, nutraceuticals, and food industry within multicultural environments. He has had strong knowledge of nutraceuticals products and hands-on experience with our main global suppliers. With a PhD on pharmaceuticals technology, Dr. Alberto is also able to give appropriate suggestions on best suitable formulations according to a specific active ingredients and consumers' requirements. Before we introduce and also diving deeper into today's sessions, we would like to request a few minutes of yours to participate in some of the food questions in order for us to gather more insights and also to better understand your need. It will directly appear on the screen. All you have to do is just to insert your answer in it. Are you guys ready for the first questions? Here you go. Let's start with what would be your primary reasons for exploring new ingredients? Alrighty, we are seeing like a very active participation here. Let's move on to the second questions. What about, are you currently using Propolis? Cool. Let's move on to, if you're answered to yes, you're currently using Propolis, which sources of Propolis are being used? Or if it's no, which sources of Propolis you will be interested in exploring? Excellent. Then we will have our next question, which is, in which application area do you want to leverage the antimicrobial or anti-inflammatories and antioxidant activities of Propolis? Will it be immune health, respiratory health, or in the gastrointestinal health? Let's move on to our last question, which is, Which of the below will be the considerations while you select a propolis? It seems like most of our audiences would prefer efficacy as his main considerations, Doctor. All right. Thank you for your active participation. We shall now begin our sessions. Let's join me in welcoming Dr. Alberto Coze. Over to you, Doctor.
Thank you very much, Angeline, and thank you all for being here today, where I try to transmit you how passionate we are in Be Natural for propolis and how we have improved these natural ingredients leveraged to a very outstanding ingredient with a high scientific value. Let me start the presentation. So, Be Natural is a team of scientists and technologists focused on scientific valorization of propolis. We have over 40-year experience in extraction and transformation of natural products. Based on that, we have developed a patented manufacturing process and a specific scientific approach that enable us to make available and prove the activity of one of the most complex products in nature, propolis. The company was established in 1980, and since then, continuous work has been achieved to drive the evolution of propolis from a traditional remedy to a characterized and standardized active nutraceutical ingredient. Be Natural now is the principal European propolis producer and leading discussion in promoting propolis and financing also scientific research to validate its benefits. A significant part of the turnover is invested in technical development and clinical studies. Be Natural is running its activity from its manufacturing site located in Corbetta, near Milan, Italy. Our industrial plant hosts an extraction line that is able to process up to 200 kilo per day of raw propolis, a filtering system able to extract up to 100 liters per hour. We have a liquid line and a spray dried line with a very huge capacity. Our operations are certified ISO 9001-2025 GMP, and we have organic certification also on site. So let's enter in the BEEHIVE world. Propolis consists of a natural resinous substance that bees collect from the tree exudates and secretion, resulting in a very heterogeneous mixture of many substances, harvested, processed, and used by bees to close hive holes and to protect the hive. Propolis acts as an immune system of the beehive. Its composition, as already discussed, is very variable and consists of average 50% of waxes, 30% resins, 30% of waxes, essential oils, and 5% pollen. It also contains other organic compounds, including vitamins, minerals, and polyphenols, which can exert beneficial effect in upper respiratory tract infection, especially due to their anti-inflammatory effect. As a major component with health benefit properties, flavonoids are the most important chemical class, followed by phenolic acids, for example, caffeic, coumaric, and ferulic acids, or even CAPA, so caffeic acid phenylether. The variability of the content of those components in propolis extract is wide and differ according to various factors. According to that can be affecting the final quality of the finished product, especially limiting the nutraceutical and pharmaceutical application of propolis itself, where standardization and repeatability are expected and high demanded. BENatural has gathered its knowledge on the science to propolis to develop a patented method of extraction, allowing to obtain a fully characterized and standardized propolis extract to match the demand of those kind of industries. This patented method of extraction allow obtaining high quality propolis standardized in polyphenol markers with a profile that remains the same no matter the geographical origin of propolis, the seasonality, or other parameters that may vary due to the naturality of the raw material. So the MED extraction process consists of an extraction starting from raw propolis, the wax, and using, after a depuration phase, a mixture between water and ethanol, starting from 100% water and slowly increasing the content in ethanol to end up extracting 100% with ethanol. This way, it's possible to extract all the spectrum of polyphenols available in the raw native propolis. That is, however, standardized in markers of interest that are galangin, quercetin, pinosembrin, pinobanskin, apigenin, and chrysin. So the alcoholic extract we obtain, that we call mother extract, is then formulated on different carriers to offer propolis in powder, acid range, microencapsulated in Arabic gum, liquid form that could be hydroglyceric extract, namely grate, ethanolic extract, namely EPE, and oily extract, namely POL, based on sunflower oil, but also soybean oil is available. All, as you can see, with the same polyphenols fingerprint to ensure the same biological activities in every batch, despite the carrier use. So those different extracts allows our customer to formulate any kind of dosage forms for a different route of administration, using the most appropriate extract. For example, sprays, both alcoholic or non-alcoholic, for oral or nasal care, lozenges, tablets, hard capsules, sachet, or disposable powders or tablet for mouth and oral care, but also suppositories, soft gels, foam for intimate care application. So our Propolis M.E.D is easing the industrial use of propolis, especially when using powder form, thanks to its free-flowing and non-sticky behavior. From our headquarters in Italy, we deliver our ingredients to more than 35 countries worldwide. We are actually operating close to our customers to support them and adapt their needs for the local market. And our ingredients are already being used in formulation, sold in the major channels like for food supplements. The commitment to quality is also a very important part of BENatural philosophy. BENatural developed a quality label for bee product extract called BENatural Quality Inside. This is not only a brand, but a seal, a real seal of quality, covering all the stages of the relationship with our customers and partners. The Quality Inside, BENatural Quality Inside logo can be added to labeling of the products developed by any of our customers to guarantee the final end user the product containing a very high quality propolis in a very high quality standardized. We also run our activities sustainability, because we engage in sustainable development, and we are dedicated to continuous improvement of our facilities, our way of working, pursuing sustainable development goals by the United Nations. So, Propolis M.E.D is not only a patented propolis extract, but it's very extensively supported by science, demonstrating its efficacy for nutraceutical and healthcare application. The most important thing is to start considering that the biological effect of propolis is relying on its core bioactive polyphenols. The multidynamic extraction process allows to obtain a larger spectrum of polyphenols and ensure that the total of a minimum of 25% polyphenols is represented by 6 main markers, as you can see here, that are apigenin, chrysin, galangin, quercetin, pinosembrin, and pinobanskin. This is the fingerprint of Propolis M.E.D, sustainable on each batch released out from our manufacturing plant. Every batch we produce has the same polyphenols complex profile, as you can see here, despite no matter of a carrier use. So Propolis M.E.D and of course its characteristic profile have been heavily studied over the last 30-40 years. The ingredient is fully characterized, and the full spectrum of polyphenols offered by nature is fully preserved, thanks to this patented method of extraction. The antimicrobial, antioxidant, anti-inflammatory properties of Propolis M.E.D have been demonstrated in several in vitro investigations. The most recent scientific development have been a demonstration of the clinical benefit on upper respiratory tract infections. However, let's consider even other main application of Propolis M.E.D. In fact, we have investigated in vitro intracellular anti-inflammatory and antioxidant mechanism of Propolis M.E.D that able to makes a difference on antioxidant status of the body. To better understand the intracellular mechanism of action, we have investigated a microRNA, in particular the epigenetic action of Propolis M.E.D. The characterized complex, polyphenol complex, showed a great modulatory capacity in modify the expression level of mRNA, so RNA messenger, associated with modulators of inflammatory and oxidative stress. So, for example, we demonstrate that Propolis M.E.D is able to reduce the RNA that produce TNF-alpha, getting a result of a reduction of pro-inflammatory cytokine in vitro. We do also had some tests in vivo, in mice, with in particular 3 different concentrations of Propolis M.E.D extract that has been incorporated in the food for those mice. Each group was treated with 1 concentration ad libitum for 30 days. At the end of treatment, the differences in the expression of proteins involved in the antioxidant pathway were confirmed. In particular, superoxido dismutase, which represents the major antioxidant line of defense, acting on superoxide anions, was found to increase significantly with corresponding no changes in catalase variation. It's proven that chronic administration of Propolis M.E.D can increase the endogenous antioxidant defense in mice. So, moreover, we test also the antimicrobial activity of Propolis M.E.D against several strains from agel families, gram-positive, gram-negative bacteria, and fungi. Those experiments were carried to determine the minimum inhibitory concentration, defined as the lowest concentration of an antimicrobial agent that can inhibit the growth of microorganisms. As you can see here, the results are of importance for any application supporting the use of Propolis M.E.D against many different bacteria and fungi species, such as skin that cause skin, respiratory, vaginal, and gastrointestinal infections. Those results, of course, are published, and even the full list of strains are listed, because this is just an extraction list of strains, but the full list have been proven efficient efficacy of Propolis M.E.D. And you can find on the publication mentioned in the slide, that of course are available upon request. Moreover, so the local and systemic use of this source, very, very rich in polyphenols, can help the body to reinforce the immune system, modulate the endogenous antioxidant and anti-inflammatory system, and regulate the anti-inflammatory response after viral or bacterial infections. So Propolis M.E.D, thanks to its standardization and scientifically proven activity, can support the overall protection of the body against external factors. In particular, this is a very hot topic. We have specifically investigated the benefits offered by Propolis M.E.D in the treatment of upper respiratory tract infections. Those are acute infections of the mucosa lining the upper respiratory tract caused by bacteria and viruses. So invasions of pathogens and their toxins induce an inflammatory response of the immune system, causing irritation and swelling, which may spread from nasopharyngeal area to the airways. Upper respiratory tract infections that we can get shorter as URTIs are very common condition, being one of the most frequent causes of a physician consultation worldwide. So they have a social effects. The most prominent clinical symptoms of URTIs are cough, sore throat, runny nose, and many others. And those are generally resolved without pharmacological treatment after more or less 1 week. But they have social effects, as mentioned before. So propolis is traditionally considered a useful remedy for the treatment of upper respiratory tract infection, but then scientific evidence is very limited. In addition, the high variability and low reproducibility of the chemical composition of propolis itself, described in the literature, makes difficult, very difficult, to correlate the content of bioactive compounds with the efficacy of propolis itself. BENatural has been running a double-blind, randomized, placebo-controlled clinical trial on 122 volunteers to evaluate the efficacy of the local treatment of Propolis M.E.D oral spray in the remission of symptoms of upper respiratory tract infections. Volunteers were healthy people, both sexes, aged between 18 and 77 years, that were considered eligible for enrolling if suffered from at least one of symptoms typically of URTI, like sore throat, muffled dysphonia, swelling, and redness of throat. Among exclusion criteria that we used, it was the use of antibiotics and anti-inflammatory drugs within the 72 hours before enrolling in the study, and the use also of the immunological drug within 4 weeks before the enrollment. Participants were randomly assigned to receive either propolis oral spray or placebo, underwent 4 visits at T0 after 3 days, after 5 days, and after a follow-up of 15 days in an outpatient setting. They received either placebo or propolis into an oral spray form, which they had to take from 2 to 4 times per day, corresponding to a daily dosage of 12 to 24 milligrams of standardized polyphenol from Propolis M.E.D per day. After 3 days of treatment, it has been observed that 83% of the subjects treated with Propolis oral spray had remission of symptoms, against the 78% in the placebo group. After 5 days, all subjects had recovered from all symptoms. But resolution from mild, uncomplicated upper respiratory tract infection took 2 days earlier, so 50% time earlier in the Propolis treated group, instead of taking place in 5 days as recorded in the control group. So the statistical analysis confirmed that Propolis, that the only variable related to the resolution of symptoms was the oral application of Propolis M.E.D. So the oral spray, Propolis M.E.D oral spray, can be used to improve both bacterial and viral mild, uncomplicated upper respiratory tract symptoms in a lower number of days without the use of symptomatic treatment. This study, of course, has been published and available upon request. So just to summarize, Propolis M.E.D is a natural ingredient obtained with the multidynamic extraction method that contains the integral complex of polyphenols naturally present in propolis, pure from inactive resins and standardized by the presence of biologically active polyphenol complex, identified, as mentioned before, by 6 main markers. Its anti-inflammatory, antioxidant, antibacterial, and antiviral activities have been demonstrated in several studies available upon request. Available conventional and organic, and thanks to the various forms available, Propolis M.E.D could be used for formulating any type of delivery system to deliver the effective dose of 12 to 24 milligrams of polyphenols from Propolis M.E.D as proven efficient in the clinical study. So Propolis M.E.D can be, as discussed before, formulated with different carriers to adapt the best to your target delivery system. It's suitable, as already introduced, under different forms, such as free-flowing microencapsulated powder, hydroglyceric, hydroalcoholic, or oil-based extract, making the formulation work easier. Additional data are of course available in our database. We have several additional data for different applications like gastrointestinal health, oral care, or intimate care. We do run even trials for in vitro tests for those additional applications. Moreover, I can show you here a very comprehensive examples of finished products that you can find in the market, especially in Europe. We have effervescent tablets. We have aerosols, nasal spray, some different formulation of nasal spray. We have lozenges. We have tablets, even for kids, of course. We have candies. We have medical devices with propolis inside, syrups for adults and for kids. We have drops, both for adults and kids. Association with royal jelly, many kind of candies and chewing gum and even gummies, ocular drops, hand creams, and labial stick. We have also soft gels. We have sachet or dispersible sachet, and many other examples, as you can see in those slides, because our extract. It's mainly very versatile in terms of formulation point of view. And also the most important thing is dose effective, because we have standardized our polyphenol complex in Propolis M.E.D thanks to our patented method of extraction. So thank you very much for the moment, for having following this this presentation, and I let again the word to Angela. Thank you all.
Thank you, Dr. Albertus, for your great sharing. I'm pretty sure that everyone get very, very excited and interested in these products, and also they'll have like a better understanding of the choices of Propolis they will be choosing. So we will be moving on to the Q&A sessions, but before this, let's just give our speaker 2-minute breaks while I'll be sharing the results gathered from the poll questions. I can see that everyone is getting very excited because our Q&A box is like swarmed with tons of questions, and I'm still seeing a lot coming in. So good. Guys, please, just put in your questions in the Q&A and Q&A box, and our speakers will attend to you very shortly. I'll be sharing the results gathered from the poll question for this. Let's see what the audience have to say. So the first question, it seems like venturing into a new application areas and also to improve the current product positionings will definitely be a top priority when it comes to exploring new ingredients. And also we have it's like 54% of the audience. We are glad to see that most of our audience are still interested to explore Propolis, even they have not been in contact with Propolis before this. Well, it seems like most of the users are currently sourcing New Zealand's and also Australians Propolis. But I hope that these sessions would give you a better insight for your future choices. Right, Doctor? And for the applications area, our audiences are choosing immune health, where they would like to leverage the anti-inflammatories and also antioxidant activities for Propolis, followed by the respiratory health and also the gastrointestinal health. Lastly, we have the considerations for selecting Propolis. Up to 93% of our audiences are choosing like efficacies as their top priority, followed by price, taste, and also lastly is the sauce. Yeah, and we're confident that Propolis M.E.D is going to be able to solve your concerns.
Yeah, that's a very good feedback received from all the guests, because it's very nice to see how big is their interest, and exactly. We can get a very good answer to all their curiosities with pleasure. Absolutely.
Right. So, Doctor, are you ready for the Q&A sessions?
Yes.
Sure. We have one question on the vagina health, and our audiences is asking, in the website, it does mention that antibacterial activity. Does it also help with the yeast infections? As well as for the UTI?
Yes, we have data in vitro that demonstrate the activity even yeast, and in particularly Propolis for UTI. It's very effective when especially associated with cranberry, because the antibacterial activities of Propolis can kill Escherichia coli, while cranberry helps in avoiding coli attach to the epithelium, to the mucosa. So the combination of Propolis plus cranberry could be really of help in UTI infection.
Right. Yeah. So for the audiences, it's the combinations of Propolis with cranberry. It's going to be hopefully it will be your new formulation soon.
Yes.
Yeah. Then we have another questions on what's the standardizations compound of these propolis?
We define to have six main markers of the polyphenol profile. So, meaning that those six main markers are the most abundant polyphenols in the complex, so in nature of brown propolis. And for this reason, we are decided to follow them as the most representative. So we are able to get a standardization for all those six markers because they represent the most abundant polyphenols in the natural raw propolis. It's true, as you can see, that we are able to monitor and quantitatively measure all the other polyphenols. However, the main are those six we are following, that are pinosandrin, galangin, quercetin, pinobanskin, chrysin, and apigenin.
Right. So in terms of like the taste light, how can we formulate to make the taste profile better?
That's a good question at all. Considering that we have opportunity to improve the taste both for formulation of solid dosage forms, like tablets, for example, or powder or sachet, because we have a microencapsulated extract in aerobic gum. So microencapsulation is able to avoid a direct and full contact with the sensor of the taste in the mouth. So this can really be of help in this kind of formulation. Mm-hmm. And also when any of us has to formulate a syrup or in general a liquid dosage form like a nasal spray or a spray and so on, we have hydroglyceric extract that is sweet in taste and is very suitable for children, considering that this extract is the same standardized, so you can get and maintain the efficacy of the polyphenols profile. So the extract itself is able to have a better taste rather than standard raw propolis, thanks to the technology we are using. Mm-hmm. And even is easier to flavor because the starting taste is also reduced compared to the raw propolis.
Yeah, exactly. What about if I think most of us have been contact with like the different colors of propolis, as like some of us have been seeing darker colors and some of them have been like having lighter colors of propolis. Does the colors of propolis actually define the efficacy?
Not at all, absolutely not. Because the efficacy is defined by polyphenol profile. That is the active compounds that are the active compounds of propolis. Colors can be variable and can depend on many factors, mm-hmm. especially the origin of propolis. But the most important thing is the characterization in polyphenol profile, because polyphenols is the only active part of propolis.
Right. Interesting. And also we have another question on whether the water dispersible grade will be suitable to be used in RTD functional beverage as well.
Yes, again, according to the use, we can offer the microencapsulated powder that is not fully soluble, but it is very well dispersible, because propolis is a resinous, insoluble substance. Mm-hmm. So even if you microencapsulate it, but still in the heart of the microcapsule, propolis is there. So we are able to get it more dispersible, easily dispersible in water, but not fully soluble. For functional beverage, our suggestion is to move with the hydroglyceric extract that is fully soluble in water, can be added without any problem to a functional beverage, and as discussed before, has already a good taste. So it could be, in our opinion, my suggestion, the most suitable extract for functional beverages.
Mm-hmm. Sure. And also we have another questions on the thermal stabilities, and to understand better whether our propolis will be able to withstand heat exposure, especially like in the product manufacturing processes. What is the max temperatures that we can go, and also how long it can be heated?
Consider that we process propolis in a spray dry up to 180 degrees for a very short time, but it's under 80 degrees. We know that for a limited amount of time, like 10 to 15 minutes, at this temperature, the polyphenols profile is stable because we do analysis before and after the treatment. Mm-hmm. But we are speaking about propolis itself. We have customers that is using for fortified foods, like bakery mixture. And in bakery, the temperature in the oven could reach up to 250 degrees. And we have data that is stable. So it really depends on the process you are thinking about. But generally speaking, I can say that up to 180 degrees, propolis is stable. Moreover, if it is included in a matrix that can surround more and slightly protect, but it really depends on the final formulation.
Mm-hmm. Sure. And I guess we are having like a lot of concerns of the groups of people to consume this propolis. For example, they would like to know whether some people who are allergic to bee products, will they be able to consume? What about the pregnant woman group, the lactating woman group? Will there be any concern for this group of people?
Actually, I have to say the full truth, that is, we do not have data available, but even in literature, doesn't exist any data specifically addressed for pregnant women or lactant women and so on. We do have, according to our knowledge, a very strong indication that is not problematic for those kind of people. But it's true that we do not have data, and doesn't exist anywhere data about the consumption of propolis in this kind of population.
Right.
So it's a good question, but we do not have enough data to say absolutely yes. We are confident, but we do not have any scientific support.
Good. And also, there's a question from your market experience. Will it suit GI irritation problem as well, using propolis?
Again, good question. We are running a clinical trial on GI tract infection, in particularly on dysbiosis. Mm-hmm. So the oral consumption, we are evaluating the oral consumption of Propolis M.E.D, so with a standardized polyphenol profile, and how it's able to work in dysbiosis. So keep the balance of the good probiotics, considering to act antibacterial, so to protect from infections, from pathogens in the GI tract. We do have very preliminary results that are good, mm-hmm. but that are positive. But we will let you know soon in 2022 the final results, because we are expecting to close the study in 1 month, more or less. So we will have for sure.
That.
Yes, stay tuned.
Okay. And also we have some of our audiences are interested to know more about the MED technology as compared to the CO2 extractions.
Yeah, this is something that we have to care particularly for a couple of reasons. The first one is that in Europe, CO2 extraction, it's a very limited technology because it can lead to have in Europe a novel food ingredient. So a very, very complicated on regulatory point of view. On the other side, with MED extraction technique using ethanols as a solvent, we are able to extract the full polyphenolic profile deriving from the raw propolis, considering both polar, mainly phenolic acid, and non-polar, mainly flavonoids molecules. With CO2 extraction, using just CO2 as a solvent, let's say, CO2 itself is non-polar. So the extraction of polar compounds, like mentioned phenolic acids, can be less efficient and requires combination with other solvents. And last but not least, CO2 extraction techniques is very high cost, is more expensive than a traditional extraction process.
Mm-hmm. It sounds like today most of our audiences are more interested in knowing the applications of propolis and different, in different grades of propolis for different applications.
Mm-hmm.
And we see the graph. And do you mind to just explain sort of like how this can be applied to different applications?
You mean the different application according to different carriers?
Yeah. And also the different grades.
Yep. Generally speaking, the powder extract is most suitable for tablets and capsules and sachet. Even because of the technological characteristics, because it's a free-flowing powder, so you do not have problems of sticky or other clogging, for example, or other problems in the equipment that with a standard propolis, raw propolis, can happen. Of course, those powdered application are suitable for oral ingestion, or so the formulation of oral ingestion of dosage forms. And the liquid one, on the contrary, is suitable for all the liquid application that can be from spray, so nasal spray, oral spray, to, for example, foams for even intimate care, or intimate washes. It can be used also the liquid extract. So it really, let's say, it's very versatile ingredients. So you can use for any application of need.
Right. And also we have one very quite interesting question. Is propolis suitable for vegans as well?
Sorry?
Vegans.
It's not suitable for vegans because it can consider from animal origin. It's suitable for vegetarians.
Oh, okay.
But not for vegans, because it's considered of animal origin.
Interesting.
Yeah, even if it's true that the bee doesn't digest the product. So because propolis, it's a resinous substance that is produced by plant to protect the young buds. So it's on a botanical point of view, it's derived from flora. But the bees come to the come to the butt, take the resin and keep in the mouth without digesting and everything, but just keeping in the mouth, the salivary enzymes start transforming the polyphenol inside the resin. And once the bee reach the beehive, it spit the resin using for its function in the beehive. So it's not any digestion, it's not any kind of real animal origin, but it is considered of animal origin.
I see. This is probably something new for me as well. Yeah. Thanks for sharing this, Doctor.
My pleasure.
Sure. And now I'm afraid that we could not take in more questions due to the time constraint. So today we would really thanks Dr. Albertus and also BEEHIVE for joining us and also co-hosting on these sessions with us. Besides, we would also like to express our appreciations to all the participants for taking your time out of your busy duties to attend these sessions. We observe your excellent participations and also active discussions, and also we can conclude that the purpose of the webinar has been completely accomplished. Please do contact our sales representative or reach us at the numbers and email address below to have a further discussions. I would like to close my remarks and officially announce the end of the webinars with natural immunity is key. If the markets can turn overnight, how will the futures of the health markets you think will look like? And again, if you have not subscribed, follow, and also like us on our Facebook, Instagram, and LinkedIn account, you can feel free to do so to keep yourself covered with the latest industry news. Till we meet again, stay safe, take care, and goodbye.
Thank you very much to all.
Thank you, Doctor.
Thank you.
Sure.